I just finished a fast on one lady just now for 72 days. 72 days. She was terribly overweight. She had diabetes. She had hypertension. She had hyperlipidemia. She was having hip replacements, knee replacements, joint problems. She had skin problems. And we fasted her for 72 days.
What did she have in those 72 days in terms of drinks, electrolytes, coffee? What was she?
Great question. So she would have black tea, black coffee, water. And in the water, once a day, I tell her to put some electrolytes in there. So there's an electrolyte called LMNT, or sometimes I just tell them to go buy some Celtic salt and put half a teaspoon in there. And once a day, you take that. If you get cravings and you feel really, really hungry, take some MCT oil, a teaspoon, and put it in your water, and you can drink that as well.
I think it's worth saying that probably you shouldn't try this at home, ladies and gentlemen, because obviously medical supervision is critical here. But in the case of that lady, what was the before and after of that 72-day fast?
So diabetes, gone. Blood pressure, normalized. Weight loss, tremendous weight loss. I think she lost about 55, 60 pounds.
Wow.
Okay. And not only did she lose all that weight, yes, all that weight from her belly was gone, but even her face, under the arms. So when you lose weight in a fasting program, it's very different from losing weight when you are restricting calories. You actually retract your skin, so you get real changes in your entire body. These patients, I had one patient that fasted for 183 days under supervision. Okay. So he went from 400 pounds to 210 pounds. And when he walked into the office, you would not recognize that he's just lost all this weight because he did not look like skin on top of bones and then having to have surgery to remove all that excess skin. Fasting is a totally different physiology. In fasting, the body is doing a whole lot of things that are very different. And we can go into the physiology of fasting because that's fascinating. It's a physiology that has not been used by us. We've lost it. So one of the things about modern living, we have lost this physiology of fasting. First of all, why do we still have that physiology in us? It's because it's supposed to serve a purpose. Because we're supposed to be fasting and feasting. But now we're only feasting all the time. And we're not fasting. In order to go back to normal, you should be fasting. Fasting is supposed to be a normal part of your existence. That's the way you were designed. Not this modern industrialized living that we've been doing in the last fraction of a millisecond in the total existence of the human race.